Okay, I think it's 10 o'clock on my clock. Good morning and good afternoon and good evening to everybody around the globe who has joined us today on the ISQA portal. Thank you very much. I'm very excited to be here with the ISQA Knowledge project team. And in Canada, we have Christina, Krause and Ajay, Puri. And we're going to have an excellent hour's worth of chat around social media in healthcare. So before I start with the introductions, everybody, I just want to let you know that all participants will be muted during this conversation, but you are able to ask questions or post using the Twitter feed if you have a Twitter account. All you need to do is use the hashtag ISQAchat, that's one word, or simply look on the right-hand side panel on your screen and you will be able to see something called chat. And I know that those of you who joined earlier, we've already been chatting to you and welcoming you to this talk. So my name is Carolyn Der Vartanian. I am the program lead for the Bloodwatch program at the Clinical Excellence Commission. And I'm very passionate about social media as an additional communication tool and engagement tool that we can use in programs that we run at the Clinical Excellence Commission and also here in the Australian healthcare settings. I'm very, very pleased that the British Columbia Patient Safety and Quality Council have agreed to conduct this webinar today with us. I heard Christina and Ajay speak with the NHS and was so impressed by what they had to say. I asked them very nicely if they could do it in an Asia-Pacific friendly time. So they've agreed. So I'd like to introduce you to Christina Krause. Christina is the Executive Director with the British Columbia Patient Safety and Quality Council, and she's very passionate about improving quality of care for patients and family and has been working in this field for quite some time. I'd also like to introduce Ajay Puri, who is the Policy Leader of Communication and Engagement at the Council. And Ajay has had a decade's worth of experience working in healthcare and healthcare research. So welcome and thank you, and I'm going to pass the mantle over to Christina.
Thank you very much, Carolyn, and welcome to all of you who are on the line today and joining us. I have to say, we're very excited to have the opportunity to share our experiences and our journey with you around how we have been using social media to support us in our work here at the Patient Safety and Quality Council in British Columbia, Canada. I'll do a bit. I see that Charles has unable to hear me, so I'm Caroline. Can I just do a voice check with you and make sure that I'm loud enough?
Sure, I can hear you loud and clearly. Anybody else having difficulties in hearing Christina?
So maybe we can have somebody just connect directly with Charles via the chat room to provide him with some support.
Christina, just to clarify with the participants, I need to tell you to make sure that you've joined integrated voice conference from the communicate menu if there is no sound. So anybody else having any sound problems, just go to your communicate menu and make sure you've, I guess, clicked integrated voice conference.
Okay, and that's right across. That's right across the top of your screen, beside File, Edit, Share, View, Communicate is where they will find that. So hopefully Charles will get you on shortly. And I'm wondering if he can't hear us, probably if we could maybe chat those instructions as well into the chat box. If somebody could do that for Charles, would be great. So before we actually get into a discussion about our journey, just for those of you that are on Twitter right now, we're hoping to have a lively discussion and dialogue as well, not only through the chat room on the webinar, but also through Twitter. So please use the hashtag ISQAchat, as Carolyn mentioned. We have some of our team from the council who are on Twitter and checking as well. As I know Carolyn will be active. She's one of the best people I've seen on Twitter, actually. So I'm sure for those of you that are on Twitter while we're having this webinar, you'll have a great conversation there as well. So before we also get going, I'll ask James to launch our first poll. So if you look to the right-hand side of your screen, we will have a poll opening there. And our first question, actually, okay, we're going to flip them. This is the second poll that we wanted to ask, but we'll ask this one now instead. We can sort of go with the flow. So have a look. Okay, here it is. Thank you, James. How would you rate your experience with social media? And we'll leave that poll open for a few minutes. I'll continue on with the presentation, but we'll check back on those results in about 2 minutes. And that will give us a sense of where you're at around your comfort level with social media. So I just wanted to give a bit of background about the Patient Safety and Quality Council, about who we are as an organization and what was it about our mandate and our role that brought us to start to explore how social media can help us to achieve our aims. Our overall vision, as you know, within Canada, we have a public healthcare system. And so one of the things that we're always working towards and care about is the sustainability of the healthcare system. And so our vision is a sustainable healthcare system, but built on a foundation of quality. We certainly have recognized that high quality care can help contribute to that sustainability, and it's what our organization works towards. Our mission is to provide system-wide leadership through collaboration with patients, the public, and those that are working within the healthcare system in a relentless pursuit of quality. So our mandate, we're an arm's length organization from our Ministry of Health, and we have a number of strategic priorities and directions that really create what our work is about. We work very hard, so our healthcare system within Canada is delivered at a provincial level. So we work towards fostering what we call a province-wide perspective. How can we create networks and learning across our healthcare system to help accelerate improvement within the province? We also have a mandate around advancing the capability and the capacity for improvement, and we do this through a number of strategies. We have a quality academy where we're seeking to support people within the healthcare system around understanding around how do we effectively lead for improvement. We also have been working at multiple levels around this education strategy so that we ultimately, at the end of the day, are no longer sort of needed within the system. We work as well to accelerate improvement. We do this through quality improvement initiatives. We do this through call to action. We do this through spreading knowledge, creating energy and momentum around the opportunities that we have within the healthcare system to improve. We also have a commitment to transparency within the system and being open and transparent in all that we do. And we certainly recognize that this work is fostered through a quality culture, a culture that supports teamwork, communication, collaboration across multiple partners, multiple providers, and multiple systems of care. As I know many of us are on the journey around integration and recognizing the value when we start to design care around the patient, the opportunities that it creates. And we also, as well, want to create value. So everything that we do is meant to foster and support those working within the system around improvement. And as part of that mandate, we recognize what are the various strategies that we could use to help us to achieve our strategic direction. We certainly have been spending a lot of time around building networks, relationships, learning opportunities that we know are so critical, policy support, those kinds of things that we know are so critical to supporting improvement. But if we started to look into what are the opportunities around community mobilizing, around social movement thinking, how can we start to use those theoretical approaches to mobilize and to engage people around the improvement agenda? And that's where we actually started to look towards social media and what the opportunities for social media would be. So before we start to dive into some of the opportunities and reflections that we took around social media, and just encourage you to have a look at the poll in terms of the participants that are on the call today. Looks like we've got a few superstars, but more people who have some exposure to social media and are just good and going. So thank you, James, for putting that together and sharing that. So Ajay, I'm going to hand you the ball so you can carry on.
Thanks, Christina, for setting the stage. Hopefully people can hear me. And just raise your hand if you cannot. Anyways, as Christina was mentioning, that's what we do at the council, and I just wanted to give some context in terms of what we're doing and learning from what's happening online. As you'll see on this slide, at the top you'll have the different age groups of people, and it's broken in about 6 age groups. And across the board, what you see is that everyone is using email, number one thing. So this is how people use the internet, and the number one thing that they do is email. And the second thing that they do is search, and the third thing that they do is search health information. So of all the things that people are doing online, the third most common thing across the different age groups is that they're still searching for health information. So that puts our job at a high priority and ensuring that they get trusted information from sources like ours. And so that's what sort of persuaded us to look more into social media, digital media, and online tools to look at what we can do better and how we can get the correct information and the best information out to our healthcare provider allies as well as the patients and the public. Now, this is an engagement pyramid that we've gotten from Groundwire. It's a great resource for you guys. If you guys want to look at how people engage different communities, we definitely recommend looking at Groundwire and the work that they do. With this pyramid, you'll see two main things in this thing. One is that things go up and down, the vertical levels, and also the horizontal levels. The vertical just showcases the level of engagement or the intensity of engagement. So the bottom being the lowest level of engagement, and then the highest being the highest level of engagement. So with these 6 rungs, people can move up and down the pyramid or the ladder of engagement. The width at the bottom, as you can see, is quite large, and that showcases the breadth and the total capacity of the bottom rung being the largest. So those are the people who are just observing, and that's where we find using technology and using web-based tools are the most strongest, is where you look at the bottom. When you go up the rung to the leader and the owning side, that's where we know best on how to do personal engagement and how to do those face-to-face relationship building. When we looked at this, of course, what we realized is that social media doesn't really replace the face-to-face relationships. What we realized is that social media can be just a tool to amplify and scale the work that we do. And it's quite cost-effective rather than holding quite a bit of forums or in-person meetings. So that's one of the reasons why we've tried to use social media, is to look at the scalability and the spread. Now, this is Fred Cavazza's social media landscape. As you can see, there's quite a bit of different tools out there for people to use in social media. And what you'll see on the top is these are the tools for conversation, and at the bottom, these are the tools for interactions. On the outside are the different platforms like desktops, and as we know now, smartphones have just sprung up like anything in the last year. But people can use all these different tools for either sharing, publishing, and a bunch of other things like playing. At the center of it all, you'll see that Fred pretty much indicated that the integration of all these different tools and these areas is Facebook, Twitter, and Google+. Now, we know Google+ isn't getting the members that they're getting, that Twitter and Facebook has, but it's still in there in terms of being at the foundation. So we've looked at this and we go, oh boy, there's quite a bit of lots here, and we can't just do it all. So we needed to be strategic. So, people have asked us, maybe we should get onto Facebook, or maybe we should get onto Google+. And definitely that might work, but we should really look at how does it relate to our target audiences, and how does that align to our strategic directions, for instance, as Christina was mentioning. So we tried to look at different models, and what we looked at is that we've used this post method, and we've adapted it by Josh Burnoff, and there was Forrester. Definitely another resource for you guys to look at is Josh Burnoff. You can look and find that stuff online. And what we've used is this strategy or this method to look at all our social media and our online efforts. POST is an acronym, and there's 5 components to it. And in a nutshell, the idea is to start, instead of saying you need to have X, so say you need to have a fan page for Facebook, or you need to have a blog. The real question to ask is, who are you trying to reach, and what is the target outcome that you want from that? from there, you should choose the strategy and the technology. And so that's what the post method is all about. The first phase, the P, is to assess the stakeholders that you have in terms of their social activities. And then the O is the objectives. What do you really want to accomplish with those stakeholders? And then moving them along the continuum, or that, for instance, the engagement pyramid. And then you choose the strategy. So what kind of ways do you want to actually change or enhance the relationships you have with your current stakeholders, and how will that change? From there, you choose your technology, whether it be 1 blog or 100 blogs. Choosing your people and your objectives and strategy first helps you choose that technology. So you don't want to go jumping into all the different technologies that you saw on that landscape. There's quite a bit there. You want to be quite strategic. And the things that we love in quality, of course, is to ensure that we evaluate the different tools that we're using and really determine how we are successful with those tools. So we got another poll for you guys. This one is about your communications and engagement strategy. So just a question, you have 2 minutes, and it would be great if you can answer just like the last one. And the question is, my organization has a clear strategy for communicating and engaging with staff and key stakeholders. So either help save me, that's A, B, not so much, C, it's a pretty good strategy, or D, absolutely. So we really appreciate your feedback on that. And considering that I just showed you all the different social media tools out there and that we're using this strategy, the post method, I'll hand it back over to Christina to tell us more about the journey we're on.
Fantastic. Thank you, Ajay. So the Quality Council, in terms of our journey in using social media, we're actually just beginning. So we're hoping that at the end of this session, we'll perhaps have some time for dialogue and opportunities to learn from each other around the strategies that you're using within your organization. But at basically at the front end, we really have found and are certainly starting to leverage that this kind of communications and engagement strategy through social media, we without a doubt can engage in efforts to improve quality of care. Not only is it through fostering a learning opportunity across individuals, but also sharing relevant research articles, projects that people are working on. I find more relevant and timely research through Twitter than I have traditionally in the past, sort of relying and going and looking at journal table of contents and that sort of thing. We also very much have been reflecting around the opportunity to bring social movement thinking into quality and quality improvement. It started with Helen Bevan and the NHS and the NHS Institute's work, and we've been building upon this and looking at it within our own environment. And one of the things that we know when you're trying to engage at a wide scale around large-scale change theory is that you need to look at both strong tie relationships and what we call weak tie relationships. Strong tie relationships are those kinds that are similar people, so like people talking to like people. So when we think about an improvement work, we often say, if you're going to engage physicians, you need to have a physician there. Or if you're going to be talking with nurses, you need to have a nurse sort of do that connection. The reason why those strong tie relationships work well is because we have credibility, we've got common language, and those sorts of things. But one of the things that we've learned is that if we rely only on a strong tie relationship, that we miss the opportunity to leverage such a greater audience and resource base to help drive change. And so weak ties are those that we traditionally wouldn't be engaging with, who are different from us. And we know that when you are purposeful in engaging weak ties, that you're able to create opportunities for dialogue, bring new thinking and new ideas into often when you have sort of groupthink and strong tie relationships. So it becomes, I found on Twitter that we've connected with individuals through social media. The access becomes so much greater than our traditional communication styles. Being able to send out videos and newsletters and use Twitter to reach out and connect and build relationships becomes very, very a strong strategy. And so we do use the social media to not only engage with others, but also to tell stories. And then we also have what we call our digital strategy. Before we move on, we'll just direct you to have a look at the poll results. So we'll see here about 10% are saying SOS, we need help. Another 35% saying not so good. 26% saying pretty good. And then we've got, again, 6%, so 2 individuals who are saying absolutely. And my guess is those are also our superstars on Twitter as well, the same 2 people. So definitely some opportunity to be reflecting around what social media might be able to offer into your organization as a result of this work. And so this is the strategy that the council went through. We had long discussions. We don't have unlimited resources, as you know, and certainly, as Ajay showed in that one slide, there's just such a large number of social media tools available to us. And so we went through a very purposeful strategy development to reflect on which would be the most meaningful for us within a healthcare context, knowing that some of the traditional ways of working will be important to continue to focus on, but also trying to look at leveraging some of the new ways. And so our strategy, we've got core work around clinical improvement, around learning and strategic initiatives. And so we looked at, while we continue to have our traditional strategies of engagement through meetings and training sessions and that sort of thing, what could we do online, especially within our province, within British Columbia? We have a significantly large geographic area. How could we actually reach the province and create relationships with people? And we found that our international relationships that we've had, even outside of our province, both nationally and internationally, have driven and supported our work just as much as they have locally. So we use email. Email, without a doubt, I think within the healthcare world is a primary mode of communication. And so we become very strategic around how we use email and the way in which we send emails out for engagement. We'll get into that in just a moment. And then we made some decisions about what were going to be our priority areas. We have a very small team. We're not a very large organization. We have a total of about 18 staff, and then we have another 10 or so clinical leaders who work for us part-time. So we have 3 communications folks who run and lead a lot of our social media strategy, but we also engage the rest of our team in this as well, which we'll talk about shortly. But we've recognized for us within the healthcare context, email is very critical, but also we reflected around the value of Twitter, YouTube, and blogging. So those are our priority areas that we've chosen within social media, but also to a lesser extent, we'll be looking at LinkedIn, Facebook, SlideShare, and then always being on the lookout for new emerging tools that would be of value for us. So in terms of email marketing, we use a program called MailChimp. MailChimp is a really sort of fantastic tool, which we'll show for you shortly, that enables us to actually create very nice sort of catchy emails, but it also creates a phenomenal opportunity to look at analytics. And we are constantly using this data to drive how we continuously improve within our work. We also recognize that a lot of the work within improvement is through one-to-one personal relationships. So we're very strategic in how we engage with individuals, and then we also partner with other key organizations within the province. And so in terms of newsletters and sort of the digital way, the online way, we know the look is important. When things look clean and crisp and clear, people are more likely to read them. We also have a strategy around managing our database, and then a strategy around how can we actually engage people to respond back when we send out a more formal newsletter. What kind of opportunities do we have to create a dialogue and ask questions? And then again, how do we use that data? So a couple of things that we consider when we send out emails is who do we need to be reaching out to? So who are the individuals that we have? We look at indicators such as open rate, the time of day, the day of the week. Within industry, we know that Tuesdays around midday are probably some of the best times to send that out. I have found just from personal sort of anecdotal experience in trying to reach more senior individuals sort of one-on-one, that often the evenings and weekends are fantastic, although that's not necessarily from a work-life balance the best strategy that we would be wanting to look for. We're also very strategic around the subject line. We know that being very specific and engaging in the subject line becomes very important. And we're constantly looking at how do we grow the number of subscribers to our newsletters and to not also overwhelm people with the frequency within that. We do segment out our audiences. I think one of the things that we've learned around reflecting around social movement, thinking for quality, to engage people around just the quality agenda is too broad. And so we now are starting to segment down around our particular initiatives and rural movement. And so it's really about creating a series of movements in particular areas that overall, when they come together collectively, the additive effect will create that movement that we're looking for. And so we segment our emails often to specific groups who have and individuals who have particular interest areas, and that becomes very effective. So just like a couple of thoughts around some of the data around email. We know that the majority of people will actually receive an email when you send it out. About 2% will bounce back. About 18 to 26% will actually open it. So if you think about sort of a response rate in terms of actually clicking on the email and reading the content and opening the email, it's about a quarter. And then if you have active links or you're wanting people to actually do something as a result of your email, it's only about 2 or 5% that actually click. Now these are sort of industry standard, non-healthcare specific stats, but it's something to reflect on about how many actually take action, 1 to 3%. So it becomes one way of engagement, but certainly using that as your only strategy won't be effective. This is actually a sample of one of our newsletters that we sent out following a quality forum event we held in the spring. And you'll see here we tried to use photos to make it engaging, and also, again, tried to segment out stories so people can connect. But the nice thing with the MailChimp is that it actually, after we've sent it out, we can actually see where is it that people are clicking and what is it that most people are interested in. So you can see on the slide here, just in terms of looking at the content, that 52%, so you see here I've highlighted in yellow, clicks around the presentations online. So we know that people were highly interested and motivated to get copies of those slides from those presentations, but less so people, we had about, I think it's 7% down here, click on the forum blog, and we had recaps 9%. So one of the things for us to reflect on was, what is the value and the investment at that time, or how do we actually make that more engaging so people take the time to read and learn from those. In terms of the stories that we tell, we know that storytelling, using narratives and others are absolutely critical within improvement work. And so we not only look for stories within our own team, but we also leverage stories from our partners through call-outs and trying to engage an audience and providing a platform for those to share those stories. We use various strategies for documentation. We use written stories, blogs, videos, photo, audio. We certainly know that videos are becoming much more powerful way to communicate. And then we share these stories through multiple methods. So if we have one story, we'll tweet it out through Twitter, we'll post it on YouTube, we'll put it on our website, and we'll send it out through email, and then we'll send specific emails to our partners asking them to share in their own newsletters as well. So it becomes a multifaceted strategy. So we thought what we would do is give you a solid, concrete example of how we use all of these multiple social media tools available to us around one particular initiative. So we had our quality forum in the spring, and so we used email blasts, we shared presentations, we used blogs, videos, photos, we looked at the analytics within our website, and we also used Twitter. So we never rely on just one approach when we're trying to communicate and engage. It's a multifaceted strategy. So there's a phenomenal tool called SlideShare, where you can actually upload and share slides so that anybody in the world can have access to those. For our forum, we had 135 unique presentations that we uploaded onto the SlideShare website, the Council SlideShare website. This is just an example of the Council SlideShare site, so you can create your own account and sites on there. And so you'll see we have various presentations. We did What to Tweet in partnership with the NHS Institute. It had 2,500 views. We've had a Quality Academy graduate workshop, 932 views. But what was really interesting for us, not only did it give the people who attended the event or those who weren't able to attend access to the learning, but in our planning for this year's in the midst of now, we were able to use the data from the SlideShare count, which shows how many views, to get a sense of what was it that people were most interested in and what might you want to look at for future content. So it gives you a sense around what is of value to participants through the tracking of the statistics that you get through SlideShare. We also have the opportunity to look at analytics, so we get a sense of how many people have viewed presentations that the council has put up. So you'll see we've had, and this was from February 2012 to September, so over a 6-month period, we've had over 25,000 views of the slides that we posted on our site. And then the other nice thing is it tells us what is the source of people getting to these presentations. So we see here, is it a direct click, a direct link? Is it through searching? Is it through SlideShare itself? Or is it through Twitter? I think the blue is actually through Twitter link. Is it through Facebook? So what we've seen is that very few people are accessing our content through Facebook. And so it gives you a sense of where your audience is playing and how they're accessing that information so that you can start to target your strategies more purposefully through specific tools. So this is an example. It also tells you where the people are from. I think what's interesting for us here in British Columbia, we've had almost double the number of people from the United States viewing our presentations. We've had individuals from Spain, from China, the United Kingdom. It tells you where in the world are these people who are looking at this, what are the most popular slideshows, and what are the keywords that people are looking for. So again, it becomes very helpful in your planning for future work. We also, within our quality forum, recognize that blogs and capturing the story of what happened, especially in this day and age where we often are faced with fiscal restraint, travel restrictions. As I mentioned previously, British Columbia is a very large province, so travel is often an issue. And we wanted to make sure that even those who weren't able to attend in person had the opportunity to have the learning. And so we used blogs. We also capture presentations through video and post it on our YouTube channel. And then we also used graphic recording to capture the story as well. So again, that multifaceted strategy became very important. We also used a tool called Flickr. Flickr is a tool where you can post photos and share so that anybody has access. So we posted our photos on Flickr as well so people could get a sense of the event. People really enjoyed seeing themselves there as well. So we've definitely been using more and more video as a strategy for improvement in terms of engagement, not only for promoting specific initiatives that we have running, but also for telling stories and also for capturing the results of initiatives. We had a stroke collaborative that ran, and then we used actually a video to capture the results and the evaluation and the energy that happened within the teams that were participating in that, as well as education. We've created short videos around particular clinical education and posted those on our YouTube channel as well. So this is the Council YouTube channel. We created a video called This is the Future of Surgery in BC. We've had 1,100 views. It was a video that we created to try and engage people within the province around enrollment of 24 sites within our province in the National Surgical Quality Improvement Program. And I think the interesting thing for us is that the American College of Surgeons actually posted our YouTube video on their website to show us an example of a provincial approach to improving surgical quality. Again, you can see what people are interested in by capturing the number of views. People also have the opportunity to write comments around videos as well. So it becomes a tool that you can use to engage others. I think for us, in terms of our learning curve, Twitter is probably what we're newest to and probably having the most fun with. Twitter is in itself, I think there's often a perception that it's more of a social tool, more, like Facebook is sort of on the personal side. But I have to say, having now been on Twitter for just over a year, it is a phenomenal place to collaborate and engage with colleagues. And again, we're calling around both the strong tie and weak tie relationships. We sent out a call to action within the province recently around a sepsis initiative that was happening province-wide. I was able to find and locate ambulance workers, medics who were on Twitter, and I was able to personally communicate with them and ask them to join us in our sepsis improvement work. We wouldn't have been able to find those individuals in the same way and reach out personally to connect with them. So as an engagement tool, it's absolutely phenomenal. It can also disseminate calls to action around initiatives to very large audiences. It also is a great way to increase awareness of particular issues and also strengthen those communities and also, again, promote learning from events. So without a doubt, you can access the moment studies get published now, they're posted on Twitter. So if you follow the journals that you have interest in, so whether it's the New England Journal or the British Medical Journal or others, it becomes a fantastic way, depending on who you follow, to be very strategic and have that up-to-date information. So the council strategy and approach around Twitter, one of our aims is to be a trusted voice within the healthcare system around quality, to also support the work of our partners, but also to empower our own staff and those interested in using Twitter to grow their involvement. We know that there's not a lot of healthcare providers on Twitter. Certainly within our province, we have a very small segment of the healthcare provider population on Twitter. And one of the strategies that we have right now is to actually grow the number of people that are using this tool so that it becomes a more effective engagement tool on our end as well. So our strategy, we actually are very purposeful at how we use Twitter. So we have a multifaceted strategy here as well. We have multiple Twitter accounts. When we look at it as the organization as a whole, we have our overall council Twitter account, which is at EPPSQC. And we use this primarily to send out information. So it's less of a Twitter account that engages in a lot of dialogue, although we certainly encourage it. It's where we disseminate a lot of our announcements, newsletters, calls to action, that sort of thing. But we also have initiative-based Twitter accounts, and right now we have 3. We have a Surgical Quality Action Network, which is BC SWAN. So this is a provincial initiative around improving surgical quality. We also have a sepsis group looking at sepsis improvement in the emergency department, and then our quality forum. And those initiative accounts become, they share information and engage with people around a particular topic area. So as you remember, I talked about it's difficult to engage just around a broad idea of quality. And what we're learning is, in terms of social movement thinking, is that if we are able to segment our population or our group that we're trying to reach around what they value and what they're particularly interested in, we can be more effective in engaging. So we use those initiative accounts for that purpose. And then our staff also have specific accounts. We've listed a few of those here. And so what we do is we design an interplay between our staff accounts, our initiative accounts, and our organization accounts. So if you think about each Twitter account has a certain number of followers within that, if I were to write something, a call to action for my own personal account, CK42, then, and it's around sepsis as an example, our sepsis Twitter account will retweet that, and then our organization will retweet that, and we do that for each other. And by doing that, our reach becomes much greater, but it enables us to build those personal one-on-one relationships, and those are of value, but then also to be able to have the organizational voice as well at the same time. So really important when you're starting with Twitter and the strategy we use is to follow organizations and individuals that align with your work. So we know when you follow somebody, about 15 to 25% will follow you back. And in order to get your message out, you need to build your followers. We also very actively engage those who interact with us. So we retweet our partners. We thank people when they retweet our information. There's something called Follow Friday that happens every Friday, where you make suggestions to your followers about who they might be interested in following. And then we also create opportunities for active dialogue on relevant topics. We also try to be very purposeful in disseminating content in a way that is fresh and engaging. So we'll use strategies such as live tweeting from events so we can share that. And what's really helpful is you're going to be live tweeting from an event to let your followers know ahead of time that for the next hour you're going to be at an event, or the next 2 days you're going to be at a conference and you're going to be live tweeting so they understand what you're up to. When you're able to keep your tweets a bit shorter, so as you know on Twitter you have 140 characters, If you're able to keep them a bit shorter, it provides room for somebody to comment and retweet what you're saying. And we also disseminate links around our partner events, our council information, research articles, video clips, studies, case studies about what's working, to actually disseminate content in a way that's meaningful. So we thought what we would do is actually share an example for you that we thought was pretty exciting. So we had, within British Columbia, we have a provincial initiative around sepsis and working care within the sepsis in the emergency department. And we had a planning meeting where we actually brought leaders from across the province who committed to being local champions together. We had 57 hospitals working across the province working to improve sepsis care. And I sent out a tweet and I said, I'm excited for the first sepsis network meeting today, working to improve sepsis care and planning for World Sepsis Day, which many of you may have known this happened on September 13th. What happened was one of my followers, Ross Gray, who's in Scotland, wrote me back quite quickly actually and said, we're planning in Scotland too. We should compare notes and results. From that, so you can see now our initiative Twitter account jumped in and followed and said, yes, we should. So then we brought that interplay between a personal staff account and our initiative account. And then our organization account jumped in, and we've got different people running our different accounts and said, this is exciting. This is global learning opportunity that we have here. And so I followed up and I said, this sounds great. I'm going to send you a note. Let's set up a time to connect, and I'll direct message you. And then we had Jason Leach, who's an improvement leader in Scotland, commenting sort of in jest saying a match made in improvement heaven. The exciting thing is that initial conversation led to a global collaboration around World Sepsis Day that Carolyn was a part of. There's a phenomenal initiative called Sepsis Kills in Australia that's doing a fantastic work around sepsis improvement. We have a collaborative in Scotland. We have a group in Wales. We had a group in the United Kingdom. And together we actually met offline and collaborated around a global strategy to actually work towards having a dialogue on Twitter around sepsis as part of World Sepsis Day. And you can see from these analytics, so we created a unique hashtag. It was WSD12, and we disseminated that out and encouraged people to participate. It was actually about I think about a 30-hour conversation, 30-hour day because of the time zones that happened, but really exciting. So we had, and you can see here, just over 500,000 impressions in a 30-hour period around sepsis. And what an impression basically is the potential reach that occurs through the number of followers that people have. We had 1,100 tweets within that 30-hour period. We had just under 300 people actually tweet and use that sepsis hashtag. And there's a fantastic tool. There's a healthcare hashtag project that's called Simpler. You can register a hashtag so you can create these analytic opportunities. And you'll see here actually Christy Turlington, who I think is a model. I don't know where she's from, but she must have retweeted something to her 70,000 followers. So if you think about the potential reach that happens through Twitter, it's absolutely phenomenal. And it also tells you sort of who are the key people who are participating in the discussion. So there's some really neat analytics that helps you understand what level you were actually able to engage with as part of your strategy. So Ajay, I'm going to pass it to you around how we're using analytics.
Thanks again, Christina. That was great in terms of finding out what we're doing in terms of the summary. And as Christina was mentioning with email, the analytics that we have and the indicators we look at the same thing in Twitter as well. And before we do, I just wanted to just quickly check in and see if you guys can use the checkbox or the too fast or too slow. We have about another 5 minutes left, but we wanted to leave some time for questions. So just, if you can, just put a checkbox if we're doing okay and you're still there, and I'll keep going. So as you can see with Twitter, we use 7 indicators. So there's a bunch of things that we could look at, but we thought of bringing it down to 7 things that we could look at and look at how we're measuring our performance there. So of course, the number of followers, the number of clicks. The third thing is the number of retweets fourth is the replies and mentions. The fifth is the number of lists that we're being featured on. And sixth is top tweets in terms of content, in terms of what was popular, what was not. And the last is a thing called clout. I'm not sure if many of you have used clout. It's not to say that it is the only thing out there, but it does measure your I guess, influence on Twitter. And you get a score like this one, for instance, when you put in clout after you set up Twitter. On the next slide, you'll see here, this is a Hootsuite. It's a dashboard that we use, and this is the analytics you can get on the links, specifically the links. So when people click on things, what are they clicking on and how many times? And what you'll see here is that this is about a year data, actually, since last year, September, as you can see. From last year, September, to about this year, September, majority of our people are in Canada. So we have about 63% of those that click on links are from Canada. And in our email strategy, which, of course, focuses on Canada, so 100% of our base is from Canada, where 90-95% of it comes from our province of British Columbia. On Twitter, it allows us to easily reach other communities outside of Canada and BC. So as you can see here, we have about 13 or 12% from UK. And again, people from Australia, thanks for clicking on things. We really appreciate it. And in addition, you can see all the other countries. In addition, you can see where people come from, as Christina was mentioning, the same way as we do on email. And then at the bottom here, you can see sort of over time the number of clicks per month. And you'll see three big humps. So you'll see one which is in early December, one which is in February, March, and then one which was in July. And on our next slide, I'll just show you what those three humps refer to. So you'll see here, in December of last year, we actually posted a position for a social media and communications expert, who is now Kevin. So you can see 500 plus people retweeted it for us. And one of the big things that happened was, you can see here, Best Jobs in Vancouver, they have a huge base and they retweeted it for us without us even asking them. And so getting 500 tweets, out of all the tweets we put out in terms of links, this job position was number one. You'll also see in terms of the other humps that I showed you on the last slide, you'll see our session with NHS, we've actually hit that as well in terms of the top links that people had. So our July 10th webinar, as well as our July 17th webinar, were quite popular in terms of links. In addition, and I'll show you on the next slide, number 9 here refers to Helen Bevan, and that was when, number 8, and that was when she actually gave her health talks, one of her presentations at our conference, and that was also one of our top tweets in terms of links. So one of the things that we've also brought in, as Christina was mentioning, storytelling is one of our key components of what we do, is a program called Storify. Definitely a program worth checking, and you can actually see Carolyn. She's actually done a great one for World Sepsis Day, and you can check out her Storify by easily typing Storify and her Twitter handle, Carolyn, and you'll find all of the summary tweets that she's done for World Sepsis Day, which is fantastic. But the main thing from Storify is that it helps you leverage social networks to build social stories. So the stories are encompassing of all the people that you've had a conversation with, which is a key thing. It also uses various different networks, so Twitter, Facebook, YouTube, Flickr, and things like Instagram. It also allows you to make a sense of all the noise out there. So for instance, if you have a Twitch chat, or if you have some sort of big event with a lot of people chatting, Storify allows you to make a meaning out of that. On this slide here, you'll see this is just a summary of our Storify of back in March. We had the quality forum where Helen Bevan gave a Pecha Kucha talk. And here's just a summary and the highlights of people's tweets. Not all of the tweets, but just the ones that we thought would be relevant for people. And it picked up a lot of steam. And for instance, here, we didn't write this, but Dave Doig did on Twitter. And he mentioned something that Helen had mentioned in her talk, which was talking about dementia, saying dementia is 5 times more, people with dementia are 5 times more likely to be given antipsychotics than need be. In addition to the Storify, you can see we use graphic facilitation on the side, and that was just to summarize what was happening. We thought this was a very visual way of capturing what happened as well. Now I'll just give it back over to Christina to finish off our journey and give us the last minute reflection.
Great, thank you, Ajay. So just wanted to reflect on just some of our learnings to date and to share those with you. I think one of the pieces around social media is that there's so much out there and there's so much that could be done. And certainly within our organization, capacity is a definite issue. And so not only have we been very strategic around which aspects of social media are we engaging in, but we also have engaged our entire team within the approach. So it's not just 2 or 3 individuals who are communications folks leading this work. We've built up the capacity and capability with many of our staff to engage in Twitter themselves, for example, be able to create hashtags and look at simpler analytics for their own work, to look at Storify as an example. So again, I think capacity around how much you go to do is really important at the front end so that you can be very strategic and purposeful depending on your audience. Who is it that you're trying to engage? Where are they? And also I think on the analytics side, will you actually use the data? Collect data that you will actually act upon, because there is so much opportunity to collect analytics. If it's not, just like we say in any improvement, quality improvement effort, if you're not going to act on the data, then and you haven't for some time, maybe we shouldn't be collecting it, because I think there's so much information out there. So I think being strategic is really important so that you manage within the capacity that you have. The amount of information and funneling it, a lot of people say to me, oh my gosh, are you not on Twitter all day long now? I actually just myself would send my own strategy. I check in once or twice a day, and I sort of quickly scan through the tweets that have happened for those that I'm following. Unless I'm at a specific event and I'm engaging in live tweet chats, and like we did with World Sepsis Day in that collaboration, then we'll but try and manage the amount of information, whether it's coming through our email inbox, through Twitter. I mean, there's so much that we have access to. It's about being very purposeful in how you're going to manage that. The other piece that, without a doubt, came up within our own team, just to share the story and an experience that we had, is that how do we manage that personal use and professional use of Twitter within the organization? We are a government organization, and so we recognize that we had many team members who are very Twitter savvy, who are highly engaged on their own personal lives. We have staff who have strong commitment to different political events, so that they want to be able to maintain those outside of the professional work environment. And so our strategy there was to say, if you have you want to engage in Twitter personally, then have 2 accounts, so that you have your professional account that you engage on the professional side, and then your personal account on the personal side. And that actually appears to be working quite well, I think, within our team to sort of keep those separate. Certainly, I've heard of many people having multiple Twitter accounts and using them for different purposes in terms of who they follow, what they send out. Because if you think about the people who follow you are following you for a particular reason. And so professionally, we do keep that distinction. And that was one way that we sort of got around some of those issues that came up early on when we were encouraging our staff to use it. We know that privacy concerns, and I understand there was a question on Twitter about some of the new laws that are happening in Australia. We're hoping, Carolyn, you're able to respond to that with not being familiar with the laws in various different countries around the world. But certainly we have a policy and guidelines within our own organization. Our provincial government has social media guidelines. So having those in place is very, very important, so that you give the direction to address use, what you can share, what you can't share, because supporting staff to engage in Twitter means helping them to be successful on it as well. But without a doubt, at the end of the day, our learning to date is that social media is just a phenomenal untapped potential to help support improvement around quality of care. And we certainly hope that today has sparked some interest for you around how you might engage on this. We do have something called our Quality Chat. We're hoping it will actually be an international event, and certainly we'd love if anybody's interested. Alan, I think you're quite savvy on Twitter. We know Carolyn is. If there's anybody who's interested in sort of guest hosting a particular topic around quality, we're trying to create an international dialogue around quality through this quality chat. So quite often what will happen on Twitter is people will get together at a designated time and have a live conversation with each other. And the way they do that is through a common hashtag, as we did with World Sepsis Day. We've had a previous quality chat around how do you use online community practices to drive improvement. That was brought up some fantastic dialogue. We also, I know there were some questions on Twitter as well during this webinar about what are the basics on getting started for Twitter. We created this Twitter 101 sort of introduction to Twitter for healthcare professionals guide. It's available on our website. And then we also have our slides available for sharing on SlideShare as well. So the link is there for you. So I guess I just want to say a huge thank you to ISQA Knowledge and also for the Clinical Excellence Commission for hosting us and inviting us to speak. And I think we have a few minutes, Carolyn, for questions if we have time for that. So thank you very much.
Thank you, Christina, and thank you, Ajay. That was fantastic. I'm excited, very excited. I hope you all are. I know there's a few questions were asked on the Twitter feed. I might just repeat them, Christina and Ajay, if you don't mind.
Sure.
We had a question from Melissa asking you, how would you suggest introducing Twitter into an organisation as an internal communication tool to communicate with colleagues?
So internally then, so as an internal dialogue, I think, actually I think that's kind of fun because, within our organization, we are trying to be as transparent as we can about the work we do and the planning and that sort of thing. And I think, that would be a real opportunity. The thing about Twitter is it's public. Anybody can find it, anybody can watch it. But as an organization, if that's something that you're trying to do, to share and to learn, that sort of thing, I think Twitter might be an opportunity to do that. In terms of how do you introduce Twitter, I think, I'd encourage you to have a look at the guide that we put together. But I also think I would connect with, if there's anybody who you know more locally who could come and connect with you and sort of really walk you through it, I'd encourage you to do that as well. But I think certainly the experiences, and we can send out, maybe we can tweet out links to Carolyn Storify that happened for World Sepsis Day as an example of the power of Twitter and how you can capture the conversation and the kind of learning that happened there. I think it's just really about, and I think, John, I'm just seeing your comments in the chat room here. Yeah, not only do the IT people, but I think, healthcare providers themselves also sort of have this view that social media is all sort of just fun and personal and social, versus it being a very strategic tool to help us to drive our improvement work. And I think it's about gathering those specific examples around how people are using it, showing leaders. So we have some, I think, fantastic leaders that are on Twitter. You can find them and you can actually show what it is that they're tweeting about. You can look at the New England Journal Twitter feed. So you can show clinicians, look, you will find out in real time what the latest publications are as an example. So I think it's about showing those concrete examples of how people are using it. Without a doubt, there is a whole bunch of social stuff going on Twitter, but you only see what you follow as well. So if you're very purposeful and strategic in terms of who you follow, you can get tremendous, tremendous value. But I think it's about engaging our IT people around that strategic conversation about what are the goals that you have within your work. And when we think about improving quality of care, so much of that is built around relationships and solid engagement and change. It's also about the process improvement and the system redesign. But if we don't engage with people in a way that gives them an opportunity to dialogue, and if you're spread out a huge geographic area, Twitter becomes a very effective engagement tool. I think on the confidentiality within our own organization, just looking at Hannah's question there, we have guidelines about what people can tweet about and what they can't tweet about. And so we have our own internal guidelines about what's appropriate for tweeting and what's not. We could post a link to our provincial government social media guidelines on Twitter so people can access those. And perhaps we can send them to you as well, Carolyn. I don't know if we can send them out as a follow-up to the registrants who are on today's call, but we could probably send a few of these items so that if they're not currently on Twitter, they can get access to those as well.
Sure. Thanks, Christina. There was a question from Ali. It's in an Australian context, and you referred to it. And it's about what happens when, for example, hospitals set up a Facebook page, and because the very nature of social media is that it's extremely public and it's immediate. Sometimes you can get negative or what we call in Australia trolling on social media, on your Twitter account, on your Facebook account. How do hospitals who have a really important role protect themselves from that, or how do they respond to negativity or criticism on things like Facebook? Do you have any tips on that?
I think, what we do online needs to mirror what we would do offline in terms of responding to criticism. I think, certainly when we think about transparency within healthcare, things that we thought the public weren't aware about, they already knew anyway, certainly around things like adverse events. People, the public, I think I often hear people say, well, we knew bad stuff was happening, we just didn't know if you knew that bad stuff was happening. And so I think transparency is always a good thing, and I think the responses, you can look at various industries, for example, about how do they handle complaints that come through Twitter. I was on an airline, I was flying to an event on Sunday evening. Their entire computer system crashed, and they weren't able to generate flight plans, and they weren't able to fly. I was in an airport for 4 hours waiting. I went onto Twitter to look at what were people saying, and people were writing the airline publicly saying, how could you do this to me? My flight at this time, I'm going to miss this. And they were responding, and to those, and they would encourage people to what we call direct message them as well. It appeared to be getting too personal what those people were putting on Twitter, and they will follow up with them directly. So you can take those conversations that it's there to acknowledge it, and then take it offline and manage it in the way that we always do. So I think, it's just working the way we always work, but through a different medium. I don't know, Carolyn, if that answers your question, but that's the way I've been seeing it work quite well.
Yeah, I think, thanks, Christina, it does. And I think, certainly when I talk about social media to my fellow colleagues, I say that if you're going to start using social media and you've got a strategy for it, you need to be prepared to think about, how you are going to respond to negativity or people trying to trash your site for whatever reason, just for fun, whatever. But you just need to think about it. It's no different to getting a nasty email. You have to respond to it professionally, but you do have to respond to it. That's the thing with social media. Don't bury your head in the sand. And thanks. So that's last question coming up. We've got a few questions on the chat panel, and perhaps we can continue the conversation on Twitter or even email. But Alan asks, what will happen if we do not use social media in health? What is the risk if we bury our heads in the sand? Yay, Alan. Christina, Ajay, any words of wisdom?
I think Alan is just bang on, and I think also, John, your comment here about email burying us and the direct interaction, I have to say companies that are really, really connected with the people who are using our services are on Twitter, and they are having conversations and responding all the time. So not only for that, I think when we engage with our patients who are concerned, it creates that real-time opportunity and a very public and transparent way to demonstrate the values that we have around responding to different concerns. But I think, Alan, I have to say, you've got it. Without a doubt, if we continue to work with the groups around those strong, high relationships, we'll continue to get the same, I think, kind of thought processes that we've always had. And without a doubt, if we think about how do we accelerate our work, knowing that in this day we're being asked to do so much around improving quality of care at a pace that I don't think we've ever seen before. Twitter, through engagement and partnership, the work we're doing around sepsis has been absolutely, we are moving through that and learning probably 6 to 9 months faster than we would have if we'd gone at it alone, maybe even faster than that. So the global learning and the conversations and people supporting each other is just phenomenal. So if we're going to meet the challenges within the healthcare system today, I think social media is going to help us get there.
spot on. Thank you. That's fantastic. Okay, it's 11:05. Thank you very much. Well, in Sydney anyway. Want to thank you very much, Christina and Ajay as well, for really a brilliant and extremely informative presentation. And it was great to see some of those frameworks, Ajay, that you put up, because there are a lot of myths about social media, and you've shown us that you can actually use social media from an organisational perspective and embed it in evidence and embed it in frameworks that will help guide you on how you use that. Thank you, everybody who joined us from around the globe. Good night, good afternoon, and good morning, and keep tweeting if you would like to keep talking. Thank you and goodbye.
Thanks so much.
Thank you.
Good night. Good morning.